Welcome to Payment Matters. I'm your host, Jeff Lynn. Thanks for tuning in today. On this show, we talk about the ever-changing landscape of healthcare payments and the impacts to healthcare payers, providers, and consumers. You can follow the conversation on Twitter at hashtag Payment Matters and follow me at Jeff B. Lynn. My guest for today's episode is Dr. Alan Young. Dr. Young is a physician executive with diverse clinical, corporate, and entrepreneurial accomplishments. He earned a dual MD MBA degree at USC's Keck School of Medicine and Marshall School of Business, and obtained his medical license during his orthopedic surgery residency. He has been able to combine his passion for business and medicine throughout his career, and currently serves as the Chief Medical Officer at Giant, scaling AI and NLP solutions across health systems to improve workflow efficiencies. Alan, thank you for joining me today. We're recording this in the midst of a global pandemic of COVID-19. So it's really fortunate to have Alan on today's broadcast. Alan, you may just introducing yourself here for our listeners.
It's a pleasure to be on it, and glad I can find time in the midst of all the things that are going on in today's world, and pleasure to share some thoughts and ideas and have a conversation with you. I think you captured, the bulk of all the things that, are of interest to this group. But I think one of the key points is in the midst of this crisis, while working for a digital health startup, I still continue to practice medicine and see patients and speak to doctors and nurses on the front lines. And so the solutions we're trying to build and deploy really are addressing active and current pain points to really help alleviate the burden on the frontline healthcare workers that are going into work every day and trying to find masks and gloves and gowns. I think those are the real people that, we want to help support and serve during this time of need.
You have the really sort of interesting perspective here and experience where you were on the front lines, and you still are on the front lines, but you've also transitioned to focus on healthcare technology. How did you move from being a practicing physician to moving into technology, and what sort of drove that movement there?
That's a great question, Jeff. I think it started back when I first was introduced to healthcare and realized that there's a business side to healthcare, especially here in the United States. It's a very complex health system. And when I was pursuing my business degree, I realized that technology has played a pivotal and fundamental role in how other industries have really advanced the way that they operate. And as I started practicing medicine and learning medicine, I think the opportunities came up to be involved in this technology development process. You can imagine doctors, if anyone can still recall, actually had to write things down on paper and use pens and just write a prescription on a pad and give it to a patient. But during my time in medical school, we started exploring the use of electronic health records and really being a part of the development of what we call computerized provider order entry or physician order entry, and building order sets where instead of having to write everything down, we could use a mouse and a computer and click and actually render care. And miraculously, patients would receive the medication that we clicked into a computer. And I think that was this first start of being exposed to the design and development of these software tools. And as I worked in the consulting space, all of a sudden, healthcare systems and executives were struggling with, once they built a computer system or paid a vendor to deploy an electronic health record, how did they get their doctors to adopt it? How did they train them? And how did they design it for maximum efficiency? And so a lot of the work I did in the consulting space with Cerner and Epic as two of the more popular vendors was really around optimizing these solutions and training physicians and showing them how the technology could enable their current clinical workflows or make it more efficient and hopefully alleviate some of the burden that they have, which in some ways is contributing to ongoing physician burnout because of the continual demands of the system. But there is aspects of the technology that I found to be very beneficial. My early entry in the technology since then has just exploded as I've gotten involved in local organizations here in Southern California and across the US, including HIMSS, the Healthcare Information Management Systems Society, as well as organizations like AI Med that focus on the use of artificial intelligence in medicine. Kind of those two organizations have really propelled me into things beyond the EMR and looking at technology as a way to continue to enable physician and patient relationships outside of the electronic health record.
This is interesting here, the dichotomy here, which is you have both sides in this experience here. And really the key focus here is really helping these clinicians and doctors out there in the field. And, I'm thankful that we're not in that realm of all paper, right? That would be horrible in this current state. But maybe you can talk a little bit about sort of what your current company is, Giant, and really how are you reacting to COVID-19? I assume that there's a major transformational shift that's occurring right now, but maybe you can describe for our listeners, what are you guys doing in regards to COVID-19?
Yeah, that's a great question, Jeff. I'm happy to talk a little bit about Giant, the healthcare software startup that I joined. And what Giant has been doing for the last couple of years is really to build a platform that enables patient-centered communication by utilizing automation, machine learning, and natural language processing to provide a virtual assistant for patients to be with them throughout their care journey or pathway. And the reason for this is we believe that episodic care for patients, meaning that you see your doctor, you don't see them for 6 months, or you only go in when you're sick, contributes to really high utilization and unnecessary ER or clinic visits. And the way to prevent that is to create a communication channel where a patient who's at home, relatively healthy, may have some new symptoms or have questions about their medication, have a direct communication channel to a reliable source of information without adding more burden to the clinical team, such as the doctors, nurses, or front desk staff who cannot proactively reach out to patients as much as they would like to, or can they handle the incoming number of calls. And that's kind of a great segue into what Giant has been able to help with during this time of uncertainty and the stay-at-home mandates, as well as many people now concerned about their health because, as you guys know, the symptoms of COVID are very insidious, meaning that it might just be a cough, might be a fever, might be feeling a little short of breath, might be tired, all things that we've gone through in dealing with the flu or the common cold. But now there's all this uncertainty for patients where they might have it. And what do? They want to reach out to a healthcare professional to be evaluated or reassured that they don't have it. And this has created a huge surge of demand for healthcare services in specific areas, such as the emergency department or a nurse triage line. And unfortunately, the limiting factor is the number of healthcare professionals on the other end. And here in the U.S., a lot of organizations are built to operate at near capacity in order to be as efficient as possible from a cost and revenue perspective. So that doesn't leave a lot of margin for error. But when we have a surge like this, there is not enough human resources to meet this demand. And the fact that Giant has this platform already built in with this virtual assistant that can automate a lot of processes, that can help guide patients based on their symptoms by taking a thorough history via a virtual assistant through the web or a mobile app, and then being able to tie that directly into what they should do next. And using the expertise and the input from our health system clients, they can direct us to say, these patients who are maybe elderly or have high risk for complications due to a pre-existing heart condition or lung condition, or this person was recently next to someone or exposed to COVID-19, they're at much higher risk. We need to evaluate them and see them, but do so in a way that doesn't endanger the greater population. So maybe we can do a telephone visit or a video conference call as opposed to telling them to show up in the ER. And I think our tool has been able to reach like hundreds of thousands of people now across the U.S., across multiple states and health systems. And we're just kind of beginning to really make an impact by helping guide patients not only to the initial point of care, but also being able to provide the information for what if you still need to get tested? What if you got tested and now been told to stay home? There's no one checking up on these patients the way that we would like to be evaluated or monitored. And I think our tool is going to be able to enable patients to have access to information and get reassured that they're getting care from their doctors or health systems in a way that wasn't previously possible.
Got it. And this COVID-19 emergency response assistant. So just to be clear, this is a thing that's live today in the market, and it's already been released by your company.
Yeah. Exactly. And the COVID-19 screener and emergency response assistant, or SCRA, SARA for short, is live right now. And the best way for anyone to experience is just going to the website, www.giant.com. But if you are a member of a health system that's one of our clients or partners, you'll notice that the same experience exists on their website. And so there's many large health systems with over 100 hospitals down to single community hospitals that are deploying or already have deployed this tool. And by notifying their patient population about this tool, they've seen immediate relief of some of the other channels we talked about. So just to kind of go over how we've been able to help in some cases, a lot of these inquiries happen outside of business hours. As you can imagine, no one gets sick between 9 and 5 Monday through Friday. So maybe they're a frontline worker and now they're developing some symptoms. Like they're not going to be able to get into those regular hours and get their answers addressed. So having this tool to kind of guide them through, what to look out for, what symptoms they might have, where they can get testing, or what number to call is really, really valuable. And it offloads, again, a lot of the need for having a large number of phone operators or clinicians to be able to answer all these questions one by one. We find that, again, when you think about frequently asked questions, patients have this ask the same question over and over again. Everyone almost always will ask similar questions. And it doesn't require a doctor or nurse to typically give those answers over and over again. I don't think that's the best use of their clinical skills and their license, but we need to provide patients with information rather than sending them to a website or expecting them to Google or expecting them to go through all of the CDC web pages and become a COVID-19 expert. So having a conversation with the patient in a channel that's useful and informative to them has been a big benefit for our health system partners. And one example, one health system that serves a large state actually saw a 30% drop in their telephone call center volume at around the same time that our tool was rapidly deployed and made available. So you can see that patients are turning to their mobile devices and their laptops to get information rather than picking up the phone and calling and potentially getting a busy signal or being put on hold and being told there's a 2 to 4 hour wait time, which is an experience that I know many people have encountered so far.
You hit on an interesting thing here, which is adoption of this, and great to see that the calls have gone out because it's not only the clinicians that are getting impacted, it's the call centers and the frontline staff that who's picking up the phones or sending an email inquiry. That's amazing there. Let me just take a quick pause here. If you're just tuning in, you're listening to Payment Matters. I'm joined by Dr. Alan Young, and we're really discussing patient engagement in this time of the COVID-19 pandemic here. As we talk about this adoption, let me ask you this question here, which is, I think in your product that you have today, that you've deployed not only for COVID, but more broadly, the end patient and or consumer is interacting with a mobile device or on the website. Is that how it normally works?
Yes, they could be a browser that opens up to a health system or a company website. You'll be prompted to engage with what you call a web widget or a chatbot. And then just by typing in, answers or clicking a simple button responses, you can get all the information and direction you need.
What's the reaction been from the consumers and patients out there with sort of this machine learning, natural language processing, AI technologies and interacting with that? Has there been any reluctance on that or any issue from adoption perspective?
Yeah, I think I could draw a stark contrast between where we were just a couple months ago and now. And consumers in healthcare prior to the recent surge in demand for these types of digital tools prior to COVID-19 were really slow to adopt to these kind of patient engagement strategies that are really mainstream and widely adopted in other industries that we use every day, like retail, travel, banking, entertainment. The use of on mobile devices, on-demand services, automation, all of those things, we take for granted in other industries. But in healthcare, I think there was just a reluctance, not only from, maybe some consumer segments, but also from the organizations that deliver care. So the idea of moving kind of the industry from a fee-for-service model to a value-based model kind of encountered a lot of obstacles, meaning that to make revenue, you want your patients to come in and get procedures and get tests, and so you can bill for them. Unfortunately, a lot of these things don't need to be done in the hospital or even in the clinic setting. So a lot of these things can be done via virtual or done via an asynchronous method. And I think a lot of organizations just were reluctant to admit that, yes, we can replace how we deliver standalone traditional medicine in a clinic or hospital with a digital tool. And so I think the fact that was restricted by not only health plans or health systems, hospitals, even individual doctors' offices or clinical offices, that didn't give, users or patients like you and me the option to even use those tools. And then consumerism now has been driven where people are using these tools outside of their health insurance. They're adopting to pick up kind of these concierge practices. And we see a surge in that where more and more generational populations don't even have a primary care physician elected or feel like they even need one because they could just pick up their mobile phone, make an appointment for a, concierge type clinic, show up, get a full physical done, or even get a prescription sent to them via, an application on their mobile device. I think that adoption curve was slow because there was a lot of hardline populations that said, medicine is sacred and we need to kind of continue to practice it this way. But now you see that without that access or ability to go see your doctor, you still have the same needs. You need your medications refilled. You need to know whether or not you should go into the ER. You want to know answers to your questions. And this shift is a very seismic one. I heard some chief digital and chief strategy officers say that it's advanced the adoption of telemedicine by 10 years on average in the places that they function now. So the number of people using telemedicine and using asynchronous care or virtual care or virtual assistants to answer their questions has exponentially increased. So stark comparison, a couple months ago, adoption was slow and was still kind of climbing and slowly progressing. Now all of a sudden it's kind of sharply increased, and it remains to be seen how much of that returns. I think we're in a new paradigm now, and the way healthcare delivery is going to be viewed moving forward is going to be fundamentally different.
Yeah, there's a great segue here, which is, this is the fundamental change. It's amazing to see the acceleration that's occurring here. You did reference telemedicine, right? I call it social distancing technologies to a certain extent, right? You don't have to go into the office. You can engage on the website, engage on your mobile phone. It's great. You don't need to go touch anything here. How would you relate sort of your experience here with what you launched with I think Sarah is what you called it, and how does that relate to telemedicine? Is it complementary? How would you see the relationship between telemedicine and what you've launched with the COVID-19 assistant?
Yeah, that's a great question, and it kind of points to some of the key strategic partnerships we have with other companies. As you can imagine, Giant is a small startup with a limited kind of focus area on this digital platform. But we believe that enabling patients to get to the care they need in a seamless and patient-centric way is important. And that's why we partner with a number of other companies. And one of them delivers asynchronous care, the ability to actually take a history from a patient, use that information, surface that to a clinician who can determine a diagnosis and actually render treatment, and then e-prescribe the medications needed to the patient's nearest pharmacy so they can pick it up at their convenience. I think that is, again, Giant is enabling us to identify more and more patients that can benefit from this type of care delivery model. And it doesn't apply to all conditions. As you can imagine, if you have a mole on your arm or you need surgery, you're not going to be using telemedicine or video conferencing, at least not in maybe our lifetime. But the idea is there's a lot of common conditions that can be treated using this modality, as long as the patient and the provider and the system they work in are comfortable and they deploy the technology in a thoughtful, safe, and judicious way to enable that. So again, it would be a bad patient experience if you needed to log into 3 or 4 different systems in order to get to that kind of care. And then what if the prescription doesn't get sent to the right pharmacy and you show up and it's not there, or the provider, misdiagnoses you, right? These are all risks that happen if you don't have a well thought out integrated solution. And we believe at Giant that by integrating with partners that can do this well and do that only, we can enable that conversation and direct patients to the right care.
It's funny, sometimes you go to these large conferences and there's probably hundreds or maybe even tens of thousands of apps that are out there that promote engagement. And clearly we're in a unique time here, but is there as these health systems or large healthcare organizations are looking to adopt these new technologies, i.e. telemedicine, telehealth, these digital patient engagement technologies, is there a secret sauce is there like a magic recipe for a healthcare organization to say, yeah, here are the X number of steps to make sure that patients are leveraging these digital tools so I can be focused on the critical aspects of care? Wanted to kind of get your understanding and your experience on what's the right way to engage with these patients from a digital engagement perspective.
Yeah, and that's a very challenging question. I won't profess to say the right way, but a way that has worked for our company is to understand the needs and demands of a healthcare executive. Being in their shoes before, they get inundated with different vendors and different solutions and multiplicity of tools that do the same thing. And unfortunately, a lot of startups do tend to focus and laser focus on doing one thing and one thing really well. But if you're a health system executive, you have hundreds of other issues and problems you need to deal with. And to bring in one vendor to solve one pain point and then realize you have to negotiate with them, contract with them, do security clearance with them, make sure they're HIPAA compliant, make sure they're interoperable with your current existing infrastructure is a daunting task, even if the benefits are really tangible and apparent. So the approach we've taken is we wanted to work with some of the largest and most respected health systems, meaning that their influence has a halo effect. So if a large organization that is well respected across the country is now adopting Giant's technology, we hope that other systems or hospitals without the same level of resourcing or ability to do due diligence and interview multiple vendors would say, we trust what they're doing. We know that they are on the cutting edge or are willing to take a chance and make sure that they vet the right partner before they deploy a software. So we hope that by doing that with, a number of key cornerstone clients, that will set us apart initially from startups that are more interested in grabbing a large number of clients, but not necessarily knowing who's really going to have a long-term impact and influence. The second piece is not being a point solution, being a system or a platform that can enable future features into the system, meaning that if we have what's called a virtual assistant on your web page, what we refer to as the Giant front door or digital front door, we can enable a lot of interactions. And these interactions could be, managing your payments, which you're probably familiar with, or scheduling an appointment, finding a specific physician that does a specific procedure in your town, getting care, getting a prescription refilled. All these things patients may go to a website initially to solve, and without a front door to guide them, they're going to, flounder around or get frustrated. But once we enable them with our tool, we don't have the ability to operationalize or kind of execute on those final needs. So we're not the ones that can really find all the detailed information about a physician and their specialty, the insurances they accept. We have one of our partners do that for us. If someone needs an asynchronous virtual care visit, we have a partner enabled that's connected directly to the Giant platform to do that. So I think those two things are really what we've kind of set out to do in order to get through this myriad of different apps that are available. And we want to make sure that patients are able to experience Giant and get the help that they need.
Similar to like raising a kid, it takes a village and a lot of people and a lot of partners to get this done here. Alan, this is, as you indicated, really trying times here for the entire world. And just really the last question here is, where do you see healthcare going in the U.S. post-COVID? I know we're going to be getting out of this, but and then where do you see this happening in the next 3 to 5 years? And where would you like to see the industry going?
Yeah, Jeff, and I'm a positive thinker, and I'm with you. We will get through this as everyone pulls together, and it's not going to be comfortable. It's not going to be an easy task, but I think we will, overcome this and move on. But once we do kind of ride over the wave, and once that curve, we hit that inflection point and things start to improve, I think the patient needs for healthcare will be even more pronounced once COVID-19 is in the rearview mirror, because it's not going to be eliminated, meaning that there's a chance it's going to come back. So we have to really rethink how we handle and screen and identify potential cases. Now that we have experience with this pandemic, I hope our health system leaders will adopt to ensure that this type of, widespread disaster does not occur again, or at least to this extent, because the impact of the economy and people's ability to live a normal life has been greatly, reduced during this time. The other reason is because of the allocation of resources to fight the pandemic, mostly all health systems have delayed or canceled what they'd consider routine care or even semi-urgent, surgical or medical procedures. And so what this means is there's a large host of patients who have underlying conditions, diabetics, people with heart failure, people with cancer, families trying to proceed with IVF. All these things have now been delayed. And I think the need does not go away. I mean, some of these conditions, if not treated, will actually get worse and make the outcome of that patient, even more difficult to deal with. And so there's going to be a huge surge again as patients start to go back to see their clinicians or hospitals for catching up, or what we call, sick care. But the challenge around that is also around, because of the financial situation a lot of healthcare organizations are facing. Many clinicians, despite the overwhelming demand for services in the emergency department or certain hospitals, a lot of clinicians and healthcare workers are being furloughed or terminated. And it's not that easy to kind of rehire and retool your clinic or your health system with the right specialized clinicians, because there's credentialing issues, there's availability, there's going to be job market constraints. People may be reluctant to go into healthcare after this. There may be too many people trying to get into healthcare. It remains to be seen. And I think that the state of kind of our healthcare delivery system has been, all the flaws have been exposed, if you will, by COVID-19, for good and for bad, not only on the delivery aspect, but the care infrastructure, the way our systems are in place to, handle the poor, the uninsured, the underinsured, the elderly. All these things have been exposed. And I think that hopefully this will cast a light and allow for improvement and increase in efficiency for our system. But I think it's going to be a big wake-up call for a lot of people who have functioned under this assumption that the way healthcare has been operating in 2019 can continue indefinitely and will continue to ride this, relatively recession-proof industry. But as we've seen, even in this types of crisis like this, no job is safe. And if people who work these jobs can't be kept safe and healthy, then that doesn't matter either.
Thanks for your candor, Alan, and thanks for the optimism. I share that with you, that we're going to get through this, and there's brighter days ahead. And really, I want to for our listeners, really those are the really key payment matters that we're tackling today. Thank you once again to my guest, Dr. Alan Young, for joining me today. Alan, if our listeners want to go learn more about you or the company, what's the best way for them to contact you?
Yeah, thanks, Jeff. Thank you for having me, and I'm happy to share. And hopefully, this kind of just raises awareness about what is happening currently in the healthcare industry and also what Giant is working on. Please feel free to visit the Giant website. Again, it's www.gyant.com, and you can learn more about our COVID screener and emergency response assistant, which is widely available publicly and for free, as well as on many health system and health plan websites now. To reach me, my email is alan@giant.com. So happy to have any inquiries directed that way. I hope everyone out there continues to stay safe and healthy, and listen to your local or state or federal healthcare experts as we continue to find the best way to navigate this COVID-19 pandemic. And I wish everyone a great day. And thanks again, Jeff, for having me.
Great. Well, thank you once again, Alan, and thank you to all your listeners for listening in. Hope you are staying safe right now here with your friends and family. And remember that you can listen into these episodes weekdays at 4:30 a.m., 12:30 p.m., and 8:30 p.m. Eastern. You can also listen on Apple Podcasts and Google Play Music, or just say, Alexa, play Healthcare Now Radio. If you have a comment about the episode or the show, follow #PaymentMatters or connect with me on Twitter @JeffBLin. You can learn more about the show at healthcarenowradio.com or instrument.com. Until next time, everyone, I'm Jeff Lin.